BYU did one of the most comprehensive studies in the country about masks and how helpful masks are to preventing the spread of the virus, and that's why we've done this. Again, masking is a very small thing that we can do. It's a small price to pay to be able to protect the lives of so many people. We came dangerously close to overwhelming our healthcare facilities. In fact, many of our hospitals had their ICUs at over 100% full, and that's incredibly dangerous. It's incredibly dangerous, of course, if you contract the coronavirus, but it's also dangerous if you contract anything else. And so to get us through this pandemic until we can get our most vulnerable vaccinated, it's still so important that people wear masks. And we're encouraging, if you can, to even upgrade those masks. There are different variants now of the coronavirus that have entered the United States. We found some of them in Utah. We only have the capability to look at about 10% of the samples of those that test positive for coronavirus and map those out to see what variant they are. But we have had some of the UK variant coming into our state, and what we know is that it is easily contracted. It is easily spread. It is more viral than the original coronavirus that is here. So that's going to be important for us to continue to be careful until we can get everyone vaccinated and we can get those numbers that are coming down that we wear masks. And if you can upgrade to an N95 mask or a KN95 mask, we would encourage you to do that to protect yourself, again, as well as protecting those around you. So I just want to thank everybody who has been willing to wear masks. I know it's not fun. I don't like it either, but it's made a huge difference. Also, some really interesting numbers today came out. We looked at the flu. Of course, this is flu season. In fact, this is peak flu season. We were able to compare our flu rates with those of the past 5 years. And one of the biggest concerns our healthcare folks had is that with a surge in coronavirus cases and people being hospitalized and in the ICUs, that if we had a spike in flu as well, like we normally had, we would completely decimate our healthcare system. Well, really interesting, because of mask wearing most pronounced, that line compared, normally we would see a huge spike right now, and that line is flat. We have seen very little flu in our state right now, and so it's having this other impact of protecting our hospital capacity right now, which is a big deal. I can't wait to be done with the mask mandate. That will be coming soon. As soon as we can get our most vulnerable vaccinated, then we will be able to move on from that mask mandate and get things back to normal.